Welcome to the second part of this lecture, which is on the value of healthcare in improving health of the individual and the population. What motivates individuals to consume healthcare, since many therapies can be painful? Would one ask for a total hip replacement just because one wants to enjoy the experience? Unless one is a masochist, I would argue that healthcare is rarely enjoyed in itself. Healthcare is primarily consumed because these services are believed to be able to preserve health or bring about better health. However, the causal effect between consumption of healthcare and improvement or preservation of health does not necessarily exist. There are many instances in which specific health interventions have not been proven to improve health. Though not all medical therapies have been proven to be effective, many are. For example, history has shown that population health has been improved by mass vaccination of children against certain infectious diseases of childhood, such as polio and pertussis. Good antenatal, intrapartum, and postpartum care have also been proven to prevent maternal deaths. Thus, I would argue that the availability and adequate use of appropriate health care can promote and improve levels of population health. Provision of health care requires large inputs of resources. Provision of health care is labor-intensive, can use sophisticated technology, and can be very expensive. Unfortunately, there are never enough of the good things in life, including healthcare resources. For individuals and countries, consumption and provision of healthcare is often limited by available resources. It is thus necessary for decisions to be made to ensure that scarce healthcare resources be distributed fairly in a socially acceptable manner. If a country has limited financial resources, what should the country invest in terms of healthcare services? How much should resources be invested in curative care versus preventive care? How much should be invested in primary care provided in clinics versus secondary and tertiary care available in hospitals? How should available health resources be distributed geographically? All are difficult questions, since the answer lies not just in the science, that is, whether services are cost-effective or not, but also in social values, that is, should the services benefit the majority who may need them less or the minority who needs them more. It is generally held that healthcare should be distributed equitably, or in other words, fairly, such that levels of health are also fairly distributed. Different societies have different perception as to what constitutes a fair distribution of health and healthcare. As an illustration, contrast the manner in which healthcare is delivered in the United Kingdom and the United States of America. In general, the people of the United Kingdom believe that healthcare should be available to all, including those who are poor and cannot afford to buy care. Hence, there is a tax-based National Health Service in the UK. In contrast, the people of the United States of America generally believe that healthcare should be treated like any other good and be available to those who can pay. Hence, the American health system is predominantly based on private health insurance. The structure of a health system in any country closely reflects the general societal view on how healthcare should be distributed. Many countries share the same healthcare philosophy as the United Kingdom, that healthcare be available to all. These countries, including Malaysia, have now achieved universal health coverage or are now striving to achieve universal health coverage. Universal coverage is essentially a situation where the whole population of a country has access to good quality services according to their needs and preferences, regardless of their income level, social status, or residency. It is an absolute concept in that 100% of the population must be covered for the same scope of benefits. Universal health coverage incorporates the policy objectives of equity in payments. That is, the rich should pay more than the poor. Financial protection, that is, people should not be impoverished as a result of using and paying for healthcare. And equity of access or utilization, that is, healthcare should be distributed according to health needs rather than ability to pay. What this essentially means is that people should pay what they can afford and obtain healthcare services when they need them. The current understanding of universal health coverage is based on the concept of health for all put forward by the WHO in 1978. How can a country attain universal health coverage? The country would need to ensure that entire population can obtain access to healthcare facilities. Entire population can obtain access to essential medicines and technologies. Sufficient numbers of well-trained health workers. A functioning and sustainable system of health financing. It is contended that universal health coverage cannot be achieved without an effective health system to organize, finance, and deliver healthcare services to the entire population of a country. The components of such a system will be discussed in the next section. This concludes the second part of this lecture, which is on the understanding of the contribution of healthcare towards improvement of health. Here are some additional reading material which will provide more detailed discussion on the issues I have mentioned.